Good morning, beautiful people. So today we are talking about Botox or neuromodulators. Botox is a brand name, so we are going to call them neuromodulator because I am not only talking about Botox as a brand. There is also Xeomin and Dysport, and more or less they kind of work the similar way. I'm not going into the nitty-gritties of how they are different, but as soon as you listen to these discussions, the first question pops up into mind. Oh well, like, is that like safe for us? The answer is absolutely yes. Only if it's being provided by a certified medical professional who knows how to inject and what the dosages and the proper techniques. So common uses, I mean, everybody knows about the cosmetic uses for botulinum toxins. It to relax your muscles, and that actually in turn relaxes your wrinkles. So how does it happen? So you have your big muscles of your face kind of like moving, and when you're smiling, when you're frowning, when you're like sad, when you're surprised. But the thing is, you shouldn't have any residual permanent creases after that emotion. Well, you don't want to be looking sad or mad or whatever for the rest of your day. So the static lines is what we're trying to treat with the Botox. So little bit how it works. So we will inject a few points in a very specific zones. After looking after your facial movements, we'll determine how many units you would need, and we will inject those, and then within 24 hours they're absorbed into the muscle layers, and then you just wait. So it could start anywhere between 2 to 3 days and could take up to 4 or 2 weeks to show its full effects. Once it's done, you will still have movements of the muscles. It's just not going to be as strong as before. So how does that look? Like, you would still be able to look up or frown, but you're not going to have those major wrinkles. And most importantly, when the muscles are slightly weaker and they're contracting, but they are not contracting as hard, they're not going to make as big creases on your skin. So what does that do? So that will actually reduce the amounts of new static lines formation. However, what to do about the ones that are already there? Well, eventually the idea is that your body will to some degree regenerate the skin, and that comes to the next part of our discussion, so stay tuned for that one. The skin should be regenerating good enough that the older static lines are taken care of. Now, the indications that commonly people don't know about Botox or neuromodulators, and in this case it's okay to say Botox because Botox is the only brand that is Health Canada approved for these medical reasons, is A, chronic migraines. So chronic migraines could be very debilitating. So if you are suffering with chronic migraines and you are taking medications and it's not well controlled, you can actually talk to your family doctor or provider to get a assessment done and potentially be assessed and treated with both botulinum toxins in your face and neck and back of your neck. And that's like a very common indication we use botulinum toxin for. Now, I keep saying the word toxin and people are like, oh my god, it's toxin. Are you crazy? Why would I get a toxin injected in my body? Well, you got it right. It is a toxin. So it is a real toxin. However, because it's very, very, very low dose, and also we dilute on top of that once we are injecting, and it's in such a low dose that it is actually not going to give you any major side effect. However, there is a common side effect that people often don't know about botulinum toxin. So Botox, Xeomin, Dysport, any of those could give you that. It's a general flu-like symptom. So if you have never had it, or even if you had it before, you might just feel like, wow, like I think I'm coming down with a flu. I mean, I don't feel like I have a runny nose, I don't think I have a cough, but I just feel that general muscle pains, that kind of feeling of tightness, kind of feeling like a little feverish, and then whoop, it goes away within 24 to 36 hours. So that is your common side effect that you could notice. Not necessarily you will have it, but it's quite possible. The other medical indications, so commonly we only treat it for chronic migraine, but hyperhidrosis is another big reason we could use the Botox for, and then we hyperdilute the Botox for that reason. And this time we are not actually relaxing any muscles for hyperhidrosis. We are actually attacking those little glands, not to secrete a lot of sweat, and only in a specific area. So obviously it cannot be used for the rest of your body, but it can be safely used for underarms. For that technique, obviously it is going to go inside the skin layer, so it is a bit more sensitive, so we would need a little bit of a numbing just so that you're not in pain. And I also routinely do those injections in my office, and the good news is once you get that, you will get that sweat-free shirt for next 6 months. Hurrah! So if you are wanting to know more, shoot me a text or direct message me, and I'm more than happy to answer any questions. And if you wanted to book a consultation to get an idea of how many units you might need, or if you're the right candidate, then also we can help you with that questions. And stay tuned for next part.